Sierra Fuller was just hitting her stride, building a trauma therapy practice and closing on a house with her husband, Steve. Then at 32 years old, she was diagnosed with cancer, stage 3B, requiring radiation, chemotherapy, and surgery.
Did you have any family history of colorectal cancer?
No.
No.
And I got genetic testing done, and I have no genetic markers for it either.
Sierra's story, part of what the American Cancer Society says is an alarming trend. Colorectal cancer is now the leading cause of cancer deaths in men under the age of 50, and the second among women of the same age.
We do suspect it's something in the environment, but what that is, we don't know. Likely, it's a combination of things that's affecting our microbiomes or our immune systems that may be leading to why this is happening younger and younger.
Dr. Kimmy Ng is an oncologist at Boston's Dana-Farber Cancer Institute and is seeing a dramatic increase in patients in their 20s and 30s.
Younger people tend to have more advanced cancers, correct?
Yes, the majority of our young patients who are diagnosed, unfortunately, are diagnosed with either stage 3 or 4 colorectal cancer.
Dr. Ng says screening is crucial, especially with a family history of colorectal cancer. If not, colonoscopies begin at 45. And be aware of symptoms, including blood in the stool, abdominal pain, and unintentional weight loss. Now healthy, Sierra is not wasting a minute, traveling and thinking about a family. Her eggs preserved before her treatment.
Now, yes, it would have to be surrogacy. It would be a completely different way to become a parent.
Finding the right pieces in the puzzle of life together. Anne Thompson, NBC News, Boston.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.